American Journal of Psychiatry Residence Journal podcast. My name is David Latov, and I'm an associate editor of the Residence Journal. Our guest for today is Dr. Melissa Arbuckle. Dr. Arbuckle is the Vice Chair for Education and Director of Resident Education in the Department of Psychiatry at Columbia and the New York State Psychiatric Institute. Dr. Arbuckle's academic interests focus on the intersection between education, mental health services, and evidence-based practices. She has developed model curricula on both quality improvement and resource management, and is now the President-elect of the American Association of Directors of Psychiatric Residency Training. She is also the co-chair of the National Neuroscience Curriculum Initiative, which is dedicated to developing and disseminating shared resources for training psychiatry residents to integrate a modern neuroscience perspective into their clinical practice. Thanks a lot, Dr. Arbuckle, for agreeing to sit down and talk to me for a little bit. I think the listeners are going to really enjoy hearing about the National Neuroscience Curriculum Initiative and a little bit more about just academic psychiatry in general. So I thought it might be a good idea to just start with, asking the question, what is the National Neuroscience Curriculum Initiative, or NNCI?
So, great question. The National Neuroscience Curriculum Initiative is an initiative that really began back in 2013. And part of this was developed in collaboration with the American Association of Directors of Psychiatric Residency Training, which members affectionately call AJPRJ. So this is the Psychiatry Training Director Organization for the United States. And when we started our initiative, we were thinking about how to improve neuroscience education in psychiatry. And AJPRJ had a neuroscience task force that had just done a survey of training programs and found that training programs were really interested in teaching neuroscience, but didn't have the resources to do so. So they didn't have the faculty available to teach it, and they didn't have curricula. And so we felt that developing a platform for shared resources for teaching neuroscience there was definite need, and that we could potentially help with that. And so this also emerged, another thing that AJPRJ was doing at the time is they were planning a one-day conference, part of their pre-meeting for 2014, on neuroscience, why, what, and how to teach it. So I was asked to chair that meeting, and I asked David Ross from Yale and Mike Travis from Pittsburgh to help me develop that meeting, because they were both doing really exciting things in neuroscience education, and so we thought we would bring that to the community.
Was there anything that when you all got together you thought were kind of the most important principles as you got ready to add content or get ready to put together this curriculum?
Yes. So one of the things we felt was really critical. So originally we set out to plan a one-day conference, and then as we were thinking about this mission, we realized what we wanted to do was much bigger. We wanted to really think about how we could transform the practice of psychiatry with neuroscience an integral component of the way we think about our patients and the illnesses we treat. And so we realized that was a pretty heavy lift. And the first thing we needed to do was to get buy-in. So in developing curricula, we needed to develop resources that conveyed why it was important for a psychiatrist to know neuroscience. That it wasn't just an academic exercise that we do in the classroom, but something that could be directly relevant to patient care. So one of our guiding principles was that everything we created, it needed to have a clear connection in terms of clinical relevance to the practice of psychiatry and to the patients we treat. And the other thing that was a guiding principle from the beginning was really focusing on how we teach neuroscience. That neuroscience historically has been taught by experts in the field, so people who are doing research in neuroscience. And people who are doing research in neuroscience aren't necessarily connected to a clinical trainees in terms of really understanding what's going to be relevant to clinical trainees. And the typical way of teaching neuroscience has been an hour-long noon conference, which is more like a lecture-based format. And our impression was that type of learning is pretty dreadful, particularly for something so complex as neuroscience. I mean, reflecting on my own experience of sitting in a grand rounds, and if it's heavy neuroscience and they immediately dip into, talking about second messengers or different areas of the brain, and it becomes complex really quickly.
Mm-hmm.
So we wanted to make sure that what we were developing in terms of educational resources felt accessible, that it was pitched at the right level, but that it was also active learning and engaging. So in the classroom, doing things that involves role play, construction tasks, something that really brings the science alive as opposed to passive learning.
As a fellow and trainee, I'm really appreciative of those efforts. Are there any examples that kind of stand out from the curriculum that you think were particularly useful or interesting or fun?
Yeah, so I think some of our basic neuroscience curricula that are really to reinforce basic concepts in neuroscience are pretty fun. So the 3D Brain app is an excellent, it's freely available online that you can download to your phone. It goes through all of the different areas of the brain, and it's something that you can use with patients, talking to patients about our understanding of the underlying neuroscience of their illnesses. One of the things we did at our very first conference was make brains out of Play-Doh. And when David Ross first suggested this as an idea, I was somewhat shocked that we were going to take adults and put them in a room with Play-Doh. But the reaction to people has been incredibly positive. I mean, to see people actually having fun learning has been really rewarding. The other thing that I think, so these kinds of basic kind of hands-on tasks, I think, are really great for learning. And for me, as we were talking about doing this exercise, we were going to have people make a brain out of Play-Doh. We pilot tested everything we did in the classroom. So I sat down with my son, who was 4 at the time, and said, we're going to make a brain out of Play-Doh. And I sat down and we did it together. And it was the first time that I really understood where the hippocampus was and where the amygdala was. And thought how useful this kind of exercise can be in terms of learning, as opposed to much of the other learning, which was looking at a cross section of an MRI, which really didn't help, especially since those structures aren't necessarily midline. So really figuring out where they are in space.
Yeah.
One of my absolute favorite modules that we have, we call Talking Pathways to Patients, where you role play how you would talk to a patient about the underlying neuroscience. And we have a series of videos that provide kind of a brief description of neuroscience. And the reason why I think these are so great is, one, you can quickly see the clinical relevance, but also one of the real challenges in teaching neuroscience is in psychiatry, you often have learners at very extreme ends of the spectrum. So you will have people in the classroom who have a PhD in neuroscience who know it very well, and you will have people in the classroom who did their undergraduate degree in the humanities and don't have a strong, robust background in neuroscience. And so providing an educational experience that's going to speak to both of these learners, I think, is really challenging.
Mm.
Talking Pathways to Patients makes both of those learners really meet in the middle. So it's how would you talk to a patient about the neuroscience? So you could be an expert neuroscientist, but it's still an important task to learn how you translate that to talking to a patient. And similar, if you don't know a lot of neuroscience, you kind of have to learn neuroscience to get up to speed to be able to talk to a patient at some basic level about that neuroscience. So this is why I really like that particular module.
Yeah, it sounds like it'd be really helpful. I was wondering if you've gotten any feedback or reactions from some of the programs that have implemented the NNCI.
Yeah, so the feedback so far has been incredibly positive, and that's been really rewarding part of this effort. So when we first ran our day-long conference with AJPRJ, immediately afterwards there was a lot of enthusiasm, and people felt that the approaches we were incorporating in the classroom were really very different from what they had been doing traditionally, and we were providing programs that had no neuroscience resources, a way to kind of begin to teach neuroscience. So the feedback from programs has been very positive. The reactions we've had in terms of the uptake of our resources on our website has been really far surpassed what I imagined would be possible. So, within weeks of our first conference, Dave Ross was in Brazil doing training programs for programs there, and on our website there's I think over 120 countries people from over 120 countries have logged into the website. So it became very quickly apparent that this wasn't just a national neuroscience curriculum initiative, but an international effort, and there's really a broad interest. And the feedback has also been about other learners. We started focusing on this specifically thinking about psychiatry training, but every time we talk about it, there's people who say, well, what about bringing this to medical schools? What about teaching clinical psychologists? What about nurse practitioners? The whole field of mental health. And then the other thing people have said is, what about bringing it direct to consumer? So helping patients and their families really understand the underlying neuroscience of the illnesses they have. And I think that that's where the real power comes from in terms of thinking about the potential role this work could have in destigmatizing something that's all in their head. When patients are given those kinds of diagnoses, to say, yes, it is all in your head, it's in your brain, and here's how we can understand that, I think can really make a difference for patients in their lives.
Yeah, that comes up a lot. So what are the next steps?
So one of the things we're really working on now is helping clinicians get up to speed with neuroscience. In teaching, it's clear that it's not sufficient to teach residents in the classroom about neuroscience. It really needs to be happening embedded in their clinical services. However, many of the clinical faculty weren't trained in this era where we knew as much as we know now that when I was in training, which I'd like to think is not so long ago, the way we talked about neuroscience was saying it was a chemical imbalance in someone's brain. Well, what we know is far more sophisticated than that at this point, and the way we talk to patients and the way we integrate that into our clinical care should be reflective of those advances. So helping clinicians get up to speed with what we know in the field is one of the things we're really working on now. So we've partnered with a small business to develop an app to provide continuing medical education credits for people to participate in learning exercise based upon the resources we've developed.
Oh, wow. What's the timeline for something like that?
So we just completed a phase 1 trial, which was really kind of a feasibility, enrolling psychiatrists. In phase 2, we're going to start enrolling within the next couple of months. It's a trial that includes some of these other learners I was mentioning, so psychiatrists, nurses, social workers, and clinical psychologists, to really look at the perspective of multiple different learners using these resources for self-study.
It's really exciting. It sounds like this is really developing in a lot of different ways.
Yeah.
I guess one of the last questions I would have, given that this is for the Residents Journal, I know that there are a lot of trainees out there that are interested in education and curriculum development and teaching. Are there any opportunities, or maybe a better question would be, what advice would you give to those trainees in order to allow them to explore and get experience and perhaps get involved with academic psychiatry in general and developing those interests?
Well, so I think from the beginning, I would recommend that they reach out to their training directors, the director of medical student education or director of NNCI education, to really look at whether or not there are local opportunities to get involved in medical education. And the field is really wide open, so that could be teaching small groups, teaching in the classroom, doing supervision, but it could also be getting involved in projects that are related to medical education. So surveying trainees, surveying clinical educators about their attitudes about different new initiatives, really, and being involved in developing new programs. So, I think one of the most rewarding parts of my career is working with residents who are excited about med ed and doing projects in med ed. And so I've worked with residents to survey residents, their colleagues, about their attitudes and opinions about providing primary care for their colleagues. It's really wide open in terms of the kinds of research you can do in medical education, looking at developing curricula and how those curricula might impact knowledge, skills, and attitudes of the learners, and trying to make as much as possible what we're working on together really aligned with that resident's interests. There are 2 national organizations that trainees may not be aware of that I think are really a great resource. One is the Association for Academic Psychiatry, so they have an annual meeting. And they also have some fellowship awards that residents would be eligible to apply for that provide them with travel funds to attend the meeting. Oh. And that's a great meeting because it really covers the gamut in academic psychiatry. So it's a meeting that I think would really appeal to people. So it's people who go to that meeting are residency training directors, medical student training directors, also, or clerkship directors, I guess, and also clinicians who are just interested in medical education. And that meeting is really very much focused on kind of skills for teaching, which I think is so great for the people who attend and for put together that workshop. The other one I already mentioned is the American Association of Directors of Psychiatric Residency Training. And that organization, while it is also focused on advancing skills in education and thinking about learning techniques and assessment techniques, it is also really thinks about how do we meet national training requirements. So that one has a little bit more of an administrative slant to it. The other organization that I have been less involved in is called ADAMSEP, and it is specifically for clerkship training directors in psychiatry and directors of medical student education. And that's another, they also have an annual meeting. It's another opportunity for residents to get involved.
Well, listen, thanks again for sitting down and taking the time to talk about all this. I think that trainees would really appreciate and benefit from knowing more about neuroscience, and the NNCI seems like a great way to do that. So I look forward to seeing how it develops.
All right, thanks. Thanks for the opportunity.